And we're back live inside Studio 10. You know, there are a lot of reasons why people get eye surgery, whether the goal is cosmetic or medically driven. There's one place, in Tampa Bay, that can address any of your eye concerns.
Dr. Jeffrey M. Kwitko is the one to see, and he's with us now. And first of all, welcome to Studio 10.
Thank you.
Talk a little bit about the different reasons why people come in to see you, because it's more than just something like an eye lift.
Well, I do cosmetic and reconstructive eyelid surgery. I also specialize in thyroid eye disease and cancers of the eyelid. I'm an oculoplastic surgeon, which is basically plastic surgery around the eye, and an orbital surgeon. And the orbit is the bony cavity that the eye sits in. So any diseases or trauma, that's what I deal with. I don't do LASIK, I don't do cataracts, but I pretty much do everything else.
So is it, it just kind of naturally occurs, though, as you get older, you just get, why do you get bags under your eyes?
Everything sags as you get older.
Yeah.
Everybody knows that. And as you get older, fat comes forward, and that causes the puffiness in the eyes. Medical conditions such as thyroid eye disease makes that even worse.
What is that exactly?
Well, thyroid disease is a disease of the thyroid gland, and it affects the eyes through an autoimmune process and causes swelling of the muscles around the eyes, which causes swelling around the eyes. The muscles get thick, they get restricted, so you can't move your eyes as easily.
Okay, this is if you're not taking thyroid medication?
No, you can be on thyroid medication.
And
it acts independently of the body.
Wow, okay.
And everybody reacts differently. And I follow my thyroid patients twice a year just to keep ahead of it, because if you have the extreme thyroid eye disease, can actually cause blindness. The muscles around the eye get so thick that they can squish the optic nerve, and when that gets squished, it gets damaged and you can't see any longer. These things are preventable and we can treat them, but you need to catch them early, like anything in medicine.
Well, you have some before and afters that we want to take a look at, Dr. Kwitko. That one of those addresses that very issue, but this one in particular is more of a cosmetic procedure.
Right, this is cosmetic. You can see in the upper picture of the before where you have hooding, swelling above the eye, and you have a lot of excess skin and fat.
Now, the woman almost looks like she's grimacing. Doesn't it? I mean, just from the natural way her eyes sit.
Some people say that people will complain that they look angry.
Yeah.
The brows are coming down.
Or tired.
Well, definitely tired, but angry is what we hear quite a bit. And we just basically remove the excess skin and fat, give the patient a more restful, youthful appearance, and it works out very well. It's a pretty straightforward procedure. It takes probably about a half hour to 45 minutes to do as an outpatient. Post-op, you'll have some swelling and bruising, which goes away in a week or two. And really, the only post-op care is to put some ointment on the stitches to help it heal a little bit quicker. And that's pretty much it.
And the next one does address the thyroid issue that we were talking about earlier.
Right. If you look at the upper picture, you can see what happens in thyroid disease is the upper lids get retracted. In other words, they're too high, and the lower lids are too low. And you can actually see some white between the lower eyelids and the colored part of the eye, which is abnormal.
They look a little bugged out.
Right.
Yeah.
Like if you remember the old actor Marty Feldman from Young Frankenstein, that's what he had.
Is that right?
Exactly.
I didn't know that.
Oh. And so what we do in these cases, if it's not severe enough where we have to do a decompression, which pushes the eyes in, we can manipulate it by moving the eyelids around to make it functionally a lot better, so people's eyes don't dry out and they're not uncomfortable and they can see clearer. And cosmetically, they look a lot better. We get rid of that bug-eyed look.
But I mean, this looks like a different person. Almost.
Well, it's the problem, like again, with thyroid disease is not only the appearance, but functionally, their eyes hurt, they're painful, they're watery, they're teary. It's just a dry eye gone to an extreme.
I would guess the biggest compliment that you could get is when someone comes in and says, well, everyone says I look better, but they're not exactly sure why I look better.
Well, that's the key to cosmetic surgery. Is, you know, you look at so many people who've had cosmetic surgery and you say they've had cosmetic surgery. You don't want people to give you that reaction. You want them to look better, but not
like Robert Redford looks right now. Have you seen him lately?
You need to go see Dr. Kwitko?
Oh, man.
Well, the problem is a lot of these Hollywood people have too much plastic surgery. And you look at them and you know they've had plastic surgery and they look goofy, for lack of a better word.
What made you want to focus specifically on the eyes? What was it about that?
Well, my father was an ophthalmologist, and he was, and from the time I was very little, I wanted to be an eye surgeon. Now, he specialized in cataract surgery and refractive surgery, And when I was in my residency, I met a professor who piqued my interest in oculoplastics and orbital surgery and neuro-ophthalmology, and that's really what made me go into it. So I'm in the same profession, but I don't do the same things as my father.
But you'd be a good partnership.
With my father?
Sense. Yeah.
Love my father, great man, but we actually worked together for a year and it didn't work out great.
Right.
Yeah,
but
I hear that.
He's still got to be proud, though, that you, for all practical purposes, you followed in his footsteps.
Oh,
you kind of
absolutely.
carried on the tradition.
Oh, we never got along better until after I left and went out on my own.
Now, what did your dad say? I mean, once you were practicing, and I'm guessing he no longer practices.
Well, he passed away about 10 years
ago. He did, okay. But was he just amazed at the advances that had been that were in place compared to the time when he first started?
Well, we all are, to be honest with you. I mean, it's amazing when you read the journals and you see what they're coming out with next. My father was one of these guys who was at the forefront of everything. He was the first man in Canada to implant an intraocular lens, which is now commonplace. He was the first man in Canada to do refractive surgery. And so he was always at the forefront. But we talk about this all the time, about the next great thing that was coming along. And it's just amazing what they come up with, not only in medicine, but in technology in general.
Well, one other thing that we want to point out about Dr. Kwitko's practice is that they're giving back to the community, and you can help with that by being a part of a donation process to the ASPCA. So all you're going to do is go to Kwitko.com, and we're going to show you how to do this. It's very simple. You're going to go to Kwitko.com, you're going to click on the little tab that says Facebook, you're going to end up at the Facebook page, and you're going to hit like, and for every like, up to $5,000, $1 for each like is going to go to the ASPCA. And this is such a cool thing you're doing. Obviously, you really care about animals. You have your dog, Pippa.
Correct.
So the sort of the unofficial mascot, right?
Absolutely.
Of the practice. And you can learn more at studio10.tv, too, if you've missed out. You can also find all of Dr. Kwitko's contact information if you feel like any of